Okay, we're here today again with Dr. David Fox, a vascular surgeon in New York City. And Dr. Fox, we talked earlier about the basics of varicose veins. We now want to talk about the treatment options that are available out there. And I know there in the early days were some fairly barbaric measures they took to get rid of them. I want you to go through and kind of give us a history lesson of the treatments in the past and what exists today.
Sure. Well, when we're talking about vein treatment, it's important to distinguish between the treatment of large bulging veins and spider veins. The treatment of large varicose veins in the past was a procedure called vein stripping, where an incision would be made in the groin and then a second incision would be made in the lower leg, and the abnormal vein would simply be pulled out, a procedure called vein stripping. This was certainly an effective procedure, but a procedure that required a stay in the hospital, general anesthesia, and a significant convalescence, a significant recovery period. More recently, we have new technologies such as endovenous ablation, which is performed in the office with local anesthesia. And in that, this is a minimally invasive technique that involves much less recovery. The patient's in and out of the office the same day, back to work generally within a few days. The spider veins can be treated in a number of ways. In the past, the primary treatment was injection sclerotherapy. We now have the ability to use surface lasers for patients with fair skin types in combination with injection sclerotherapy of the feeding veins. And this results in a faster and better cosmetic result with less risk of problems such as hyperpigmentation, which can be seen with traditional injection sclerotherapy.
And how about the new venous procedure as well?
There are two techniques for endovenous ablation. One involves the use of a radiofrequency catheter, which is the venous technology. The technique that I'm using currently involves the use of a laser, where a laser fiber is threaded into the abnormally functioning vein. Anesthetic is injected along the path of the vein, the laser is turned on, and the laser fiber is gradually withdrawn. As the fiber comes down, the vein is closed off.
Now, some of the questions we've heard from patients that have called in have been the veins that are removed. Are those veins that we need that you're taking out?
The veins that we're treating are extra veins, abnormally functioning veins. And if you imagine the venous system in terms of a pump that's pumping blood from the legs back up to the heart, the varicose veins are functioning abnormally. The blood is actually flowing backwards down the leg. By closing off or removing the abnormally functioning veins, we increase the efficiency of the venous pump. Okay. So actually the circulation from the leg is actually improved.
All right. And are there any risks with these procedures you've just described?
Sure. Well, any medical procedure has risks, and it's important to know what the risks of a medical procedure are before undergoing it. The risks of any medical procedure include bleeding and infection. The risk of endovenous ablation is that of deep vein thrombosis is one of the risks. It's important to remember we're using the laser to close off specific veins in the superficial system, and we have to be very careful to guide the laser so the laser energy is directed only to the superficial venous system. If the laser energy involves the deep system, a condition called deep vein thrombosis can result. It's a rare complication. When it happens, the patient needs to be treated with blood thinners for a period of time.
Okay. Bottom line here, I think, is that if you're going to have your varicose veins treated, it's always good to go to a board-certified vascular surgeon because of those risks.
That's right. During the procedure, we're guiding the laser with the use of vascular ultrasound.
Okay. Very good. Now, for more information on this, you can go to foxvein.com to get more information on the treatment options available for your varicose veins.